Hello. Yes, can you hear
Hello.
me?
Miss Friesen, can you hear me?
Okay, so my techie daughter here says you can't hear. I can't hear you. Um, my name is Margaret Friesen. I had some computer problems earlier today, so I don't have a written presentation per se, but I'd like to make some main points. First of all, I'd like to thank you very much for opening this up to the public. It's so important. I have a Bachelor of Science degree in zoology and a master's in entomology toxicology. I've got over 30 years experience working on university and government research projects, including 10 years in ecosystem toxicology and 10 years in molecular biology, working on DNA methods and studying population genetics of Arctic marine mammals. That career was cut short 15 years ago when I developed electrosensitivity. I returned to work 3 years later with accommodation for electrical sensitivity and worked another 7 years. I had the support of medical doctors in Manitoba, Ontario, and the States, a psychiatric assessment, and a 5-hour psychological assessment, which all supported that my symptoms were physical. I was very fortunate in that the second doctor I saw was the director of occupational and environmental health at one of our main medical teaching um, hospitals here in Winnipeg. And she immediately recognized my symptoms because she had attended an international conference where they had discussed that particular topic. So I'd like to talk next about a survey that I sent in on behalf of the Environmental Health Association in Manitoba. We were in the process of developing a survey when we found out about the opportunity to present at the hearing. And so we just asked 10 people who had contacted us, who had reported symptoms of electrical sensitivity to fill out the survey, and I have forwarded a copy of that to you. Of the 10 people, 3 were physician diagnosed, and 2 are considered to be environmental refugees. They're really struggling to find suitable housing even today, and things will even be worse if we get more wireless radiation, such as smart meters and things like that, which have not yet been deployed here in Winnipeg on a large scale at any rate. So electrical sensitivity is not anything new, and in some countries, well, not new today, it is for Canada, it seems to be, but there are about 200,000 people who have it in Sweden, and it's reported around the world. So it's an emerging public health issue, which definitely needs attention. I would ask the panel to interview doctors and nurses who see patients with electrical sensitivities, as well as individuals who report symptoms. And I believe your review will not be complete until that is done. That segment is on behalf of the Environmental Health Association. The next will be for myself. And I just want to say that I don't represent anybody, and I am not getting any compensation for the work I've done, nor what I'm presenting. So having been in research, one of the most important components of that is doing a very solid literature review. So I looked at some of the literature that was in the McLean 2009 report and the Royal Society of Canada report in 1999. So you're familiar with the 1999 report. The 2009 report was contracted by Health Canada to review the literature before they published Safety Code 6. So when I looked at that, so that was handed in March of, and then the contract that Health Canada contracted Royal Society to do said that the literature was current up to 2009. It is not. There are references missing in McLean 2009 and references missing in the Royal Society report of 99. There's also declassified literature that's becoming available. That can be seen on the Magda Havas site. Just look under Zori Glazer, and there's lots there. You need a systematic review and full disclosure of all of the analyses, including consideration of outliers such as Magda Havis's work on heart. You need to look at the new EMF literature, Dr. Hardell, Dr. Davis, Dr. Herbert. You need to talk to people who are doing science in this. Dr. Herault at McGill is doing excellent work, and Dr. Belpom in France is also doing leading edge work. Please pay attention to the letter that Dr. Herbert said about autism. It is truly alarming. So in conclusion, I think much work has to be done. I would hope that you would release the literature that Health Canada provided to you. If you cannot release that because of the terms of your contract, I want to remind you that you can send in an amendment. So just an amendment asking them to release the literature and that you can then release it to the public. Much of what we know has to do with having filed access to information requests. And what I would say is that this is not science inquiry at its best. So I hope that you will go back to the drawing table, take into account all the information that you've been provided, and come back with a proper and thorough, transparent, and rigorous results. Thank you very much.
Thank you. I should point out that the report eventually will go to peer review with the draft report that is written by the panel, independent peer review, and we have already requested a peer reviewer from C4ST and the public. So transparent.
May I suggest something? Dr. Herault at McGill University would probably be an excellent reviewer on this.
Well,
he did a segment in the Bioinitiative report.
Could you send that name in to Russell by means of an email?
Yes, I will.
At the Royal Society. The other thing I'd like to ask you is, what literature did Health Canada not give us?
Well, we really don't know what they didn't give you because we don't have a list. And we have, and when I say we, there are people across Canada who have independently put in access to information requests.
Yeah.
And one of those requests was specifically for the literature, and it was denied. So Health Canada won't release it to us. My understanding is that you can't because of the terms of your contract. So it would be really helpful to us to know what it is that you are looking at when you are reviewing Safety Code 6.
You mean the mandate that they gave us? Is that what you're talking about?
Not the mandate, but the list of literature. Yes, well, the mandate, of course, too. I want to bring to your attention, have you seen your contract and what we are getting from Healthy Code 6 through Freedom of Information?
Yes.
I mean, we've got major things that are blacked out. How are we supposed to know how to address the panel when we don't even know the questions that are asked? We don't even know what literature you're receiving. We don't really know what your mandate is. This is very, I certainly hope that you improve the process.
No literature from Health Canada. No literature.
Well, okay, on page 1 of the statement of work, it says the current code reflects scientific literature published up to August 2009. So there was no literature that you received.
I mean, that's all it said. That's it. We received no, you haven't received anything either. We haven't received any kind of literature review or anything from Health Canada.
Well, then why would they refuse to give it to us? Why wouldn't they just say we haven't handed anything to you?
Well, I was going to make a remark about the government, but I don't know any more than you do.
Okay, well then what we will do, or I will do, is then compile a list of literature. My bibliography program got hung up, so I'm a little behind on that. But I do have a very decent list. I've got over 800 items in my bibliography, and so I will, once that gets going, I will certainly look at that. The other thing I would suggest that you look at very closely is the submission made by Dr. Sears. She has a very comprehensive list. And when you're talking about missing, let's just go back a little bit to the McLean report and to the Royal Society report. Now, they didn't cover everything either. They missed literature. So will you be able to go back to the literature that they missed and relook at some of these things?
Every piece of literature there is on radio frequency and its effects on health, and is currently doing that. So,
Okay, the other question is, how are you doing that? How is this literature being weighted? That Dr. Havis did a study on hearts, and that piece is not, as far as we know, considered. It was not considered, it was disregarded because it was considered an outlier. Now, in science, we know that sometimes those outliers can be very informative. So I think we need to have some justification on why some studies are included and others are not. Is that going to be done?
well, I'm assuming I can't speak for the panel because I'm not a panelist, but I know that in all of the panel studies that I've been involved with, the panel has made as comprehensive a review of existing literature as is possible. Now, I don't know if you have any further to add to that, Paul. I mean, that's what it's going to do. And I've seen some of the preliminary literature that's been reviewed. It's very, very comprehensive. So whether they
Well,
did something that the 1999 panel didn't do, I have no idea.
but the thing is that we need to know how that literature is weighted. So, I mean, I know from experience, I have given two scientists, the same data, and they have come to different conclusions. So we need to know
I'm a
how
scientist for this reason, and weighting of data is not an easy thing to do, and nor is it always the wisest thing to do. Weighting of data is a very difficult procedure. I
is
mean,
this Dr. Damaris I'm talking to?
not weight it.
Is this Dr. Damaris I'm talking to?
Pardon me?
Are you Dr. Damaris?
No, I'm Dr. Flynn.
Oh, I see. Okay.
And
So I would direct that question to Dr. Damaris. I'm sorry, I've only I'm at my daughter's place. I haven't been listening to the hearing, so I don't know what's going on. But certainly there are systematic methods. The methods that health science is using are not best practices. You know, I am embarrassed by how Health Canada is conducting this whole scientific review.
well, I can't answer for Health Canada, neither can the panel. We're going to do what we're charged to do. And when the report is out, you and others will have an opportunity to peer review it. I'm not saying you specifically, but that will be peer reviewed by people that are credible within the field. And you'll have to wait and see that report.
I think that the other thing that one needs to consider are the people with electrical sensitivities. These people are in dire need of proper attention. We have people here in Manitoba who've gone to see doctors with symptoms, and the doctors are not trained to recognize the symptoms. People are being over-medicated, they're being wrongly diagnosed. That's the other thing I hope that the panel will do, is to certainly look at that subject very, very closely.
The panel is to listen to everything that people are saying and have said this morning and this afternoon, and take it into serious consideration. I can give you that assurance.
All right. Does anybody have any questions? Any of the panelists? Oh yeah, I don't know if I mentioned this, but you know, there's a fellow doing research in France called Dr. Belpom, and I would recommend that that the panel also interview that particular scientist. So not just to look at the people who are not finding anything, but actually looking at the people who are finding something and see what they have to say. It's very important in this particular case, considering the health of individuals is at stake, that we err on the side of caution. And at this point, the way that wireless radiation is being deployed, it's not taking people's health into consideration. So I hope that you will make an effort, you being the panel and Dr. Mares, will make an effort to interview individuals who are in the field who see people with this condition and are able to do anything. Really, right now, what one should be doing is putting a moratorium on Wi-Fi installation in schools. When you have children reporting adverse health effects,
I have to stop.
why? Is that not done?
Everything into consideration that you said. We are time limited. Thank you for your presentation.
All right, you're welcome.
Okay.